What are the symptoms that people should be concerned about that would lead them to a doctor to determine whether you have dementia or Alzheimer's?
The symptoms that would lead someone to worry enough that they would at least should talk to their doctor about whether they have some early process like Alzheimer's disease going on would be something that represents a change for them. And so I always tell people, when you're 20 years old and you can't find your keys, remember that, so you're not worried when you're 50 years old that that's Alzheimer's disease, but that's just as sometimes you can't find your keys. But if you're someone who never misplaces your keys and suddenly, you're 3 times a week, you're looking all around the house for them, then that would be something that would be worth looking into, because that would represent a significant change for you. The changes can be in thinking abilities, it can be in memory, but it could also be in personality, or it could be in other kinds of behavior. And some of the dementias cause personality and behavior changes out of proportion to memory changes, typically, and some of them cause memory changes more profoundly than the personality and behavior changes. The neurologist will use that as a clue to say whether it's like Alzheimer's disease or something else they call frontotemporal dementia, but that turns out not to be that reliable a clue. And in fact, if you follow patients again to the point of death and autopsy and look at 100 patients who are proven at autopsy to have the frontotemporal dementia, the majority of them during life were told they have Alzheimer's disease. But the PET scan can make that distinction very straightforwardly, because the frontotemporal dementia has the decrease in the metabolism showing up in the front half of the brain, and the Alzheimer's disease has a decreased metabolism showing up in the back half of the brain.
Is it better with Alzheimer's to detect it earlier? Like the earlier detected, the better you will be as far as dealing with the disease?
Yeah, there's a lot of evidence that it's better for a lot of reasons. One of them is the drug therapy, that if you wait till someone is severe, then there's only one medicine left, and it's not going to make them a lot better. It's just you can only get kind of marginal effects. But if you get somebody treated at an early stage, you have more choices of drugs to treat them with. And there's evidence that if you just wait 6 months to a year to start someone on those medicines, that those people will never catch up with the people who got started earlier. We've been doing research to show that if you start people even earlier than that they're not even demented, but they just have some very mild impairment, that you can prevent for a number of years a lot of the deterioration that otherwise would occur in both their declining in their brain metabolism and also declining in their cognitive abilities. It can be prevented.
As the numbers have increased in the number of cases of Alzheimer's, are the remedies or the medications or the treatment of it also improving?
It's improving, at least in the sense that now we have treatments. So when I was in medical school, there were no drugs approved for Alzheimer's disease, specifically to treat Alzheimer's disease. If you had some bad symptoms, like bad behavioral symptoms, you might get the same kind of drugs that they use to treat schizophrenics for their behavioral symptoms. But starting in the mid-90s, the first drugs began to be approved for Alzheimer's, and now there's actually 5 that have been cleared by the FDA for Alzheimer's, 4 of them that are still in fairly common use.
Are there any drug testing trials that I could be a part of, or someone could be a part of?
There are a lot of therapy trials for people who have dementia, and also people who have much earlier stages of cognitive change. Some of them are typical type of drug trials. You get a medication, or you get placebo, or you get one medication versus another medication, and you're blinded to which one you got, and the doctor's blinded to which one you got, and they measure how good your cognitive abilities are before and how good they are after. And in some of those trials, they also have PET scans before and after, so you can look at biological changes occurring in the brain. And then there's some more innovative things that are being done as therapies. For example, one of the trials here at UCLA is where they surgically implant a factor that makes neurons grow in the brain, and seeing if the neurons' growth helps to treat the symptoms of Alzheimer's disease as well.
Is it a genetic situation? I mean, should someone automatically think that they're going to get Alzheimer's just because a relative has it?
There's 2 kinds of genetic bases for Alzheimer's. The kind that people get when they're younger, the 40s or 50s, that's relatively rare, has a very strong genetic base, and if you get that gene that causes the Alzheimer's disease, you'll get the Alzheimer's disease. Just like if you get a gene for brown eyes, you'll have brown eyes from your parents. And the kind that most people get, though, of Alzheimer's disease, the kind that happens in the 70s and 80s, there's some genetic component, but it's weaker. You feel like you're doomed to Alzheimer's because you had a parent who had it, or because you have some of the genes that have been identified with it, but they do increase your chance. And so the more family members you have with Alzheimer's, or if you have the gene, like the most powerful gene that they've discovered so far for the kind that people get in older age of Alzheimer's is called apolipoprotein E. It's kind of a cholesterol type of gene, and there's 3 versions of it, epsilon 2, 3, and 4. 3 is the most common, so that's your average risk of Alzheimer's. And if you have 2, it protects you, so you have less of a risk. If you have number 4, then it increases your chance of getting Alzheimer's by a factor of 2 to 3 at any given age. So if say at age 70 you had a 4% chance of getting Alzheimer's without the gene, you might have a 10% chance of getting it with the gene. And so if you have that gene, which you probably wouldn't know unless you enrolled in some kind of research trial, or if you have family members who have Alzheimer's disease, then when you start to have symptoms, you will worry more, and legitimately so, about whether those symptoms are early Alzheimer's in yourself.
Is this something, though, by knowing that you have Alzheimer's or in early stages of it, is it possible to cure the disease or stop the disease altogether?
There's no cure for Alzheimer's right now, and that's because it's a progressive neurodegenerative disease, meaning neurons are actually dying off. And if you wait to the point that you are diagnosed with actual dementia, which is what people until just this year have waited till to call it Alzheimer's disease, a lot of neurons have died off, and those don't come back. But you can do two things. One is that you can slow down the rate that someone will decline if they're properly treated. And if you get them at an early enough stage, you may, especially since they're often at a relatively older age when they're diagnosed, you may slow it down enough that they never get Alzheimer's disease. You know, they'll just have some mild cognitive changes.
Ask your doctor about a PET scan with NeuroQ, or visit us on the web for more information about costs and scheduling.